The Canterbury District Health Board is so far in the red, the government's appointed a Crown Monitor in a bid to help improve its financial performance. It's not alone, but it is the worst. The total deficit across our DHBs is expected to hit $390 million at the end of the month. The Canterbury DHB is forecasting a year-end deficit of $103.4 million. Health Minister David Clark says it's not sustainable, and he joins me now. Good evening, Minister.
Good evening, Lisa.
In terms of the Canterbury DHB, give us the roadmap out of the hole. What does it look like exactly?
Well, as Minister, I have, under the Public Health and Disability Act, the ability to appoint a Crown Monitor to assist the DHB to improve its performance. The Monitor can attend DHB board meetings and have access to all documentation provided to the board. They are there to observe the decision-making, convey the policies of the government so that they can be reflected in board decisions, and advise the Minister on any matters relating to the DHB. And that includes the long-term sustainability of the DHB. They give the government confidence when it's investing significant money, public money, as it does in the public health system, that there is a path to sustainability if things are looking a bit rocky at any given time.
OK, well, the thing is, the salaried medical specialists say that a Crown Monitor is just scare tactics and it doesn't really do much to improve the financial position of DHBs. Is that right?
Look, I respectfully disagree with that. I've appointed Crown Monitors to counties Manukau and Waikato previously.
Yeah, how's counties Manukau's debt tracking compared to when they didn't have a monitor?
It's tracking down, Lisa, so it's a really good news story. The Crown Monitor has got in there. They have worked with the management. The management...
They're still projecting $53 million deficit, is that right, Minister? Projecting $53.5 million deficit in counties?
My understanding is that they're improving that position. So, the advice that I've got is that actually has been helpful to have the Monitor in there. Also, it's the changes that have been made at board level and at management level there. So I've got increasing confidence in counties Manukau, but we're watching it closely.
Right, so what do you think the number will be then if you're saying that there's going to be an improvement on that $53.5 million deficit?
I don't have an exact number in front of me, Lisa, but I'm told it's already improving on that number.
OK, but you can't say how much?
No, I wouldn't like to get that wrong on the or put your crook on it, but I am aware that it's improving from that position.
OK, so installing a monitor, is that kind of like a precursor to getting rid of the whole board? It's not necessarily, no. So in the case of counties Manukau, I hope that, to choose that example, that we will continue to see improvement and that we would eventually, with time, not need a Crown Monitor in that situation. What about Canterbury DHB? Are you considering options with the board there?
Well, today is day one. The Crown Monitor will start immediately at getting an assessment on the financial position that they're in and the sustainability of that position. I do want to.
But how long do you leave it? How long do you leave it before you escalate? So, what period of time are you ring fencing to say, if I don't see an improvement by then, I'm going to step up action?
There is no legal period of time. So in the case of Waikato, for example, where I put in a Crown Monitor, I've moved reasonably quickly to put in commissioners because the Crown Monitor who was in there said, look, there is clinical risk here, there is financial risk, you need to move to take extra steps because I don't think you're in the right position with the Waikato DHB. So it's the job of the Crown Monitor to go in there to get a good assessment. We've appointed a very experienced person in Dr. Lester Levy.
But as Minister, you must have an idea. Sorry to interrupt, but as Minister, you must have an idea of how long you're prepared to wear this, how long you're prepared to carry deficits of this nature. So how long are you giving the Canterbury DHB to turn things around?
Well, Lisa, these are not simple things. These DHBs are stressed and strained from years of underfunding, and the Canterbury DHB has provided excellent services. We think back in terms of the response to the quake, the terror attacks of March 15. Their clinical responses have been superb, in my view. So we want to pick apart things. This is about making sure that those excellent clinical responses are sustained into the future, that they actually have modern ways of doing their business, and that they are appropriately appropriately funded. And the Crown Monitor's job is to get in there, to work with the DHB board to make sure that they're in a financially sustainable position.
Right. If they deliver great services, how is it that they are so far in the red? Surely you're not suggesting that that's all from either, that can all be clawed back through efficiencies. So what's the issue there?
It's a matter of understanding, how much of the challenges they're facing are legacies of the quakes, how much is about the way that they do their business, as it were. I mean, the DHBs are constantly making changes. There are new ways of operating, new models of care. Things can be done more efficiently and effectively, but that sometimes requires investment up front, and that's sometimes why DHBs will struggle in one year and not another year, because they're investing in change.
Okay.
So we need to have a really detailed picture of that, and I need to be able to assure the Minister of Finance that there's a sustainable path into the future.
All right, there's a bit more that I want to get through, and we're running out of time. So Treasury, what has Treasury told you about the risk of the DHB's debt levels? How serious are they telling you this is?
Well, the Treasury, I spend a bit of time worrying about it. At one level, we invest $18 billion in the health system each year, and you could say, well, these are not big numbers compared to that, but they actually are. If we're talking about hundreds of millions of dollars of taxpayers' money, we need to be very, very sure that when this money is being spent on services, that it's being spent the best way possible.
So we have a truly
world-class health service, and we just need to be sure that it's sustainable into the future.
So this level of deficit, is it keeping Treasury awake at night?
Well, it keeps me awake at night. You'd have to ask the Treasury how
what have
they
they
feel
said
about
to you? What have they said to you?
Treasury, of course, always advise the Minister of Finance to keep an eye on things. They have expressed their concern, as best I'm aware, about the Canterbury situation. It's up to both the Minister of Finance and I to make decisions that give us the confidence that we're investing this money well. I'm, confident of the care. We just need to be sure that it's sustainable into the future.
Let's turn to the Southern DHB now. In 2017, you told this program it was the second most poorly funded DHB and that people in the South were not getting the treatment they deserve. Has that improved on your watch?
The DHB has had a good deal of money invested in it. It's had commissioners in place. I supported, from opposition, the government in appointing commissioners to that DHB.
So are people there now are they now getting the treatment they deserve in that catchment?
They are always, like every DHB, striving to give the best possible care to the people that they care for in their area.
So best possible care is different from treatment they deserve. So are they getting the treatment they deserve, which is what you were concerned about when you were in opposition?
Lisa, I want to see our public services, our public health service grow and be strengthened. It was underfunded for 9 years under the previous government. There is a legacy of underfunding. We can't fix that all in one or two budgets, but we are certainly investing in our public health system at the moment. So
is it still underfunded and the deficits are getting worse? Is that what you're saying?
I would separate out the issue of deficits and talk about changes in models of care, and certainly the Southern DHB is investing at the moment in changes to ensure that it does primary care in a more modern and effective way. That requires investment up front, and that does cost money. So with a commissioner in there, we've got oversight over how it's making those changes currently.
You also said at that time that patients were waiting 7 months for urgent surgery and that wait should only be a month. So can you tell us what the wait is now?
Well, in different areas, I'm
talking about Southern.
Different waits.
Yeah.
Sorry, for different clinical practices, it'll be different periods of time, Lisa, whether it's orthopaedic surgery or whether it's...
Can you give us a ballpark, Minister? Are the waits within a time frame that you're comfortable with, given your comments that they were too long previously?
I haven't... I've got Southern's exact details in front of me, but I am aware that, for example, they've struggled with ophthalmology late last year. They did get those wait lists down again, but we're constantly watching that because it's challenging to find the specialists that provide that care. They are working hard to improve, as all DHBs are, on their wait times. And of course, at every stage, they prioritise acute care. People who need it right now get it straight away, and that is imperative in our health system. There's a constant reprioritisation going on, and as I say, there's that legacy of underfunding, but we're investing more and we have high expectations of our DHB.
I want to touch quickly on the situation with birthing facilities. Multiple babies born outside of primary birthing facilities in the Southern DHB district recently. You will be acutely aware of this. One doctor has said you need to urgently review this situation or a life could be lost. Are you going to review it?
Personally, I've been a bit frustrated and disappointed at the way the DHB has gone about the implementation of this change. I've been assured that the plan they have is a good one to serve the needs of their population, but the actual implementation of it has caused me some frustration from afar.
So have you spoken to Chris Fleming about it?
I certainly have spoken to the DHB at different times.
But this week...
Can I tell you, Lisa, that they have now assured me that they're going to have independently reviewed the implementation of that, and I think that's the right thing to do.
And by when do you expect that review to be complete?
I haven't had that detail confirmed yet. I think they are searching for the right independent person right now, and that's important that they do have the right independent person to lead that work.
Thanks for your time this evening. That is Health Minister David Clark.